The addition of mannitol increases the effectiveness of dental nerve block anesthesia, allowing the patient to be comfortable and pain-free during surgical and restorative dental procedures, and is an essential part of the process. The most commonly used local anesthetic injection for lower teeth is the inferior alveolar nerve block. However, failure rates ranging from 10 to 39% have been reported. The current issue of the Journal of Anesthetic Progress presents a study testing the efficacy of adding a solution of mannitol to the anesthetic typically used in IAN blocks. 40 adult subjects participated in the study, receiving an IAN block at each of 3 separate appointments at least 1 week apart. The study compared the effectiveness of standard anesthetic, lidocaine with epinephrine, to the effectiveness of 2 different volumes of lidocaine with epinephrine plus half a ml of mannitol. Mannitol is a sugar alcohol that occurs naturally in fruits and vegetables. It is rapidly excreted by the kidneys. Though its impact is short-lived, mannitol has the positive effect of opening the perineural membrane. It is believed that in causes of IAN block failure, the perineural barrier around the nerve does not allow complete diffusion of the anesthetic into the nerve trunk. The addition of mannitol apparently allows enhanced permeability, increasing the success of an IAN block when administered concurrently. After injections of the IAN block solutions, subjects' pain levels were measured by an electric pulp test of their mandibular teeth at 4-minute intervals for 60 minutes. The study concluded that the addition of mannitol to lidocaine with epinephrine significantly increased the effectiveness of the anesthesia. Today, we have Dr. Ryan Swain with us talking short-term orthodontics. Welcome to Take 5 with Marty, Ryan.
Great to be with you, Marty. Thanks for having me.
Dr. Ryan Swain is CEO and president of 6 Month Smiles. He focuses on short-term ortho and other conservative cosmetic dental procedures and is constantly on the forefront of GP orthodontics. He has trained dentists internationally and prides himself on demystifying orthodontics for the GPs. Today, Dr. Swain will be speaking with us about short-term orthodontics. So, Ryan, why haven't most GPs ventured into short-term orthodontics?
Well, the simple facet of it is that we come out of dental school as GPs, and most of us really don't know much of anything about orthodontics. We don't know how to use brackets and wires. We really don't have any practical info. Essentially, we learn how to diagnose a malocclusion and then pick up a referral pad and refer that patient out to a specialist. And so dentists typically will get into doing all kinds of things for their practices: implants, perio, endo, all kinds of things, but many stay away or have stayed away from fixed ortho in the past. And so with short-term ortho, we change all that. It's very similar to an approach as with aligners in that it's for adults, it's cosmetically focused, and it's not necessarily aiming to achieve the same exact results as comprehensive traditional orthodontic treatments.
So then how does the short-term orthodontics differ from other aligner systems?
Aligners have been great for general dentists because it's given them means to get into doing ortho in their practices. The problem is there's a lot of shortcomings with aligners, as most dentists will agree, in that the costs are high and the control and the predictability over tooth movement is limited. It's hard to rotate teeth. It's hard to extrude teeth. And so what short-term ortho is all about is using clear braces and tooth-colored wires to treat similar cases, but in a much shorter period of time, because brackets and wires are simply more efficient and more effective than aligners are.
Why would a dentist choose your system over some other type?
Well, I think with the 6 Month Smile system, the key to the momentum that we have and the great feedback that we continually get from our providers is that it's a turnkey system from A to Z. Dentists can literally get involved with no ortho experience. They get world-class training that is very principled, so they know what they're doing.
And I know one thing from, again, being a provider, that your website just has a forum that lets people feel real comfortable about getting started. Tell me a little bit more about the website.
Sure, yeah, the 6-Month Smiles is a great resource for patients to find out about 6-Month Smiles and to find providers in their neck of the woods who are doing 6-Month Smiles. But also in the dentist part of the website, it's a great community, an online forum where 6-Month Smiles providers can synergize, can give each other advice, can get advice on a case, selecting cases, treatment planning, and it's just a great place for general dentists who are now doing ortho to work together to make sure that their patients are getting the best care.
Thanks very much for providing that information.
Hey, good to be with you, Marty. Thanks a lot. We'll talk to you soon. Take care.
So Dr. Swain has told us a lot about short-term orthodontics. I've incorporated it into my office, and it's a win-win for both the doctor and the patient, and it's fun. More information can be gained by going to 6monthsmiles.com.